So this is a talk that's a continuation from Module 5, and this is the talk about the roles of the public health nurses. We're going to talk about school nurses, the faith community, parish nurses, occupational health nurses, home care agencies, and a little bit about case management. So public health nurse actions include 3 levels of prevention. And we talk about primary prevention as educating to prevent a health issue. So primary prevention means that the people that you're going to work with do not have a health problem. We are trying to prevent it. So if we talk about kids wearing bicycle helmets, this prevents traumatic brain injury. That is primary because they don't have traumatic brain injury. We're trying to prevent it. Secondary means we are screening and treating, and so you're screening for hypertension, and if you have a high measurement, you're referring to the doctor, and then the doctor will treat the person. So we're doing screenings looking for diseases that are hidden so that they can be taken care of and treated. And then tertiary actions are preventing disability from a health issue. So tertiary actions for diabetes include teaching a person how to do blood glucose monitoring. So we're not looking for diabetes. We know the person has diabetes, and we're watching their blood sugars to make sure that they're maintaining healthy blood sugars because we want to prevent disability from diabetes. So when you're thinking about programs and planning and your own screening activities, think about primary education programs, secondary screening programs, or tertiary preventing disability. So all public health nurses assess, plan, implement, and evaluate. All public health nurses use that nursing process. And remember, they are concerned about the population, not just the individual. They advocate for people, they educate people, they provide direct care, they provide indirect care, which I will explain later under home care. They minimize risk for harm, they monitor outcomes, and they do research. Non-governmental organizations, NGOs, and government organizations hire public health nurses at the local, the state, or the national federal levels to coordinate public health services. And again, public health nurses disseminate information, they provide leadership, they watch over surveillance, keeping an eye on those conditions and diseases that are coming in, being reported by physicians' offices, and then directing actions to prevent, to treat, and to prevent the long-term disability. So for school nurses look at their health policies and procedures. They evaluate their own nursing practice. They have to keep up with nursing knowledge, with new medications that are coming out, with new conditions that children have. They can see a variety because they can see kids with cancer that are coming back to school. They can see kids with certain conditions, HIV, and recovering from surgeries and things like that. So they have to have a lot of knowledge. They have to hold strict confidentiality so that the gossip doesn't get out about children. They will consult with others, with primary care physicians, nurse practitioners, or other providers who are taking care of the children. They'll use evidence-based practice, and definitely the group of children under their care is who they are concerned about. But they also may be concerned about the staff who are working in that school as well. So the National Association for School Nurses recommends a bachelor's degree and an RN licensure, certification through the National Board of Certification for School Nurses, and LaSalle does have a program if you want to become a certified school nurse after you get your BSN. There is no laws about the background of the school nurse, but of course we always recommend the highest level, and schools often will hire a BSN. They also may hire a nurse practitioner. Now we have the faith-based nurses or the parish nurses. we have two models: a congregational model, which means that the nurse is autonomous in her practice or his practice. The parish nurse is working with their faith community, and it could be any faith. Parish tends to think of Christian institutions, but any faith group can have a congregational model parish nurse, faith-based nurse. Then the institutional model is the nurse who's working in relation to a hospital or a long-term care facility and providing prayers with the person, inspirational talks, and thinking of the spiritual needs of the client and the group. The faith-based nurse has to be aware of legal issues. The nurse is an advocate for the client, but when we talk about being autonomous, then the nurse has to watch how the records are stored. Confidentiality has to be maintained. If the nurse uses volunteers, the volunteers have to be vetted so that if the nurse sends a volunteer into the home, they are safe in the home. The occupational health nurse is the nurse who works in factories and manufacturing sites. It could be hospitals, and the practice of that occupational health nurse is preventative health care, health promotion, and health restoration for the workers of the company. The nurse is also responsible for a safe and healthy work environment, providing those masks and helmets and hearing protection so that people are not injured on the job, knowing the OSHA rules to follow to keep employees safe. Home care and hospice nurses work in the home. They need to be very competent in their assessment skills, and they have to be creative because they are not going to have the supplies that a hospital has when they're in the home. And the nurse has to remember that the nurse is the guest in the home. And to be effective, trust is very important to build with the family and to build with the client so that they trust the nurse coming in and the information and assessment that the nurse is doing. So here's that term direct care, which means that the nurse is performing a physical assessment, changing a dressing on a wound, giving medication, inserting an indwelling catheter, providing IV therapy, and teaching the client and the caregivers how to do a certain procedure. Those are direct care, very big part of the home care nurse, but also the home care nurse has many indirect care, things such as teaching and training about safety measures, diet, hydration, treatments, signs and symptoms of complications, consulting with other healthcare workers, organizing and participating in team conferences, looking at lab results, contacting physicians as needed, and also supervising home health aides. So there's that difference between direct and indirect care. The hospice nurse provides support and care for those in the last phases of their life. Hospice is for terminally ill patients, typically with 6 months or less to live, and the nurse focuses on the quality of life for the individual and for the family and caregivers as the dying process is happening. The core aspects of hospice nursing is that it's patient and family focused, it's interdisciplinary, the chaplain is involved, the social worker, the doctor, the possibly physical therapists for comfort measures, the nurses, the home health aides, and the pharmacists. The public health nurse, hospice nurse, is responsible for making sure the supplies are there, making sure the equipment is there, managing the medications, managing the symptoms, and then after the patient passes, working with grief support with the families, encouraging the families to go to bereavement groups to get through the passing of their loved one. So again, here, to qualify for hospice care, the patient has to have a prognosis of 6 months or less. The hospice is to promote quality of life by protecting patients from burdensome interventions and providing care at home when possible. And there is also, as I mentioned, the VNA has inpatient hospice care for patients to go to with a more more comfortable living situation than a hospital room. So I wanted to mention palliative care versus hospice care. Palliative care is maintaining the quality of life and reducing illness symptoms for any person who has been diagnosed with a life-threatening illness, but hospice is particularly aimed at those with a terminal illness and to help them remain pain-free and at home if possible. So that's the big difference. Palliative care, there's not a terminal diagnosis, but symptoms need to be managed and quality of life maintained, versus hospice. Now, I didn't have a slide on case management, but case managers are those nurses, those public health nurses who understand the client's situation and works interdisciplinary and works with organizations to get supplies into the home. So the case manager is the overall watch and guide for the patient through the process of health care and getting supplies and getting their needs met when they are ill. You'll often see case managers in diseases such as the diabetes case manager. You'll see case managers with HIV. You'll see case managers possibly in occupational health, workman's comp, to get the patient back to work. And again, those nurses are really the advocate for the patient, making sure that they get the services that they need and that their care is being delivered correctly. Thank you for listening.